So here's a liver biopsy, and if you look at it, your first reaction is going to be cirrhosis, isn't it? In fact, if you look at down here, here's a nodule that's surrounded by fibrosis, and I'll show you the trichrome stain in a minute. But there's something very odd here. Take a look at these bile ducts. Well, are they normal bile ducts? Probably not, right? There's way too many of them. Now, are they bile ducts or bile ductules? And I have another video which sort of distinguishes between the two. But here are the bile ductules. So I'm not surprised. As a chronic liver disease, bile ductules get sort of proliferate, and so that's nothing to be concerned about. What I'm really concerned about is these bile ducts. They look like well-formed ducts. They're round to oval with a very clear lumen, not a collapsed lumen like bile ductules. In addition, there's too many of them. You should have one bile duct per portal tract. This is way too many bile ducts. So this is not your usual cirrhosis, right? In addition to that, look at the size of these bile ducts. Remember, the bile ducts normally should be no larger than the size of an arteriole. If that's the arteriole under consideration, this bile duct is just way too big. And if you go along the biopsy, you'll see more and more of these bile ducts. Look at that. They're again dilated. They're trying to create these rather irregular shapes. But there's another cirrhotic nodule. So the question for you is this cirrhosis? All right, so time to answer that question. Yes, it could be cirrhosis. There are nodules surrounded by fibrosis, but that does not account for these weird ductular changes. So this is a duct plate malformation or congenital hepatic fibrosis. So this is often mistaken for cirrhosis, and the key is this very bland fibrosis, creation of these nodules, and these very unusual ductular profiles. Now, the icing on the cake would have been these ductular profiles with far more irregular shapes. And these antler horn-like configurations. But nevertheless, that is what it is. Now, there is one more feature here, perhaps a slight twist in the tail, that there is a little too much inflammation here. In fact, there is a little bit of interface hepatitis here as well. I know it's not easy to recognize on a trichrome stain. Generally, the cases of congenital hepatic fibrosis I have seen are devoid of inflammation, and this does suggest that there may be a second insult, and it could be a drug that's producing this. So, congenital hepatic fibrosis mimicking cirrhosis.